Hello, Dr. Lydia Trauth here. Okay, boosters. Y'all have been asking, and the CDC has finally given us some guidance, which we're really excited about. Okay, so you're going to have to forgive me a little bit. I'm going to be doing some direct reading just to make sure that I'm giving you the correct information. So here is who they have said should receive a booster. Now, first of all, I want you to know this is Pfizer. So if you got Moderna, you can just stop listening. If it's not been 6 months since your last one, this isn't going to apply to you. So this is Pfizer, and this is if your second shot was at least 6 months ago. Okay, so if that is you, and you are 65 or older, and then you should receive a booster shot. If you are 50 to 64 and have underlying medical conditions, then you should receive a booster shot. And we're going to talk about exactly what those underlying medical conditions are in just a second. If you are 18 to 49 with underlying medical conditions, you may receive a booster shot based on your individual benefit and risk analysis. So that may be a discussion with your doctor trying to decide, are you the right person to get a booster shot if you're under that age? If you are 18 to 64, and you are at increased risk of COVID because of an occupational or institutional setting, you may receive a booster shot. And mind you, the first two were shoulds, so 65 and 50 with medical conditions, those should. The other two, the 18 to 49, and then a occupational hazard are may, so it's a choice. They're not saying you have to, and really nobody's saying you have to. It's just they're using should versus may. May receive a booster shot if they've been at least 6 months. So, what constitutes a medical condition? Okay, so we're going to go to that page. If you have cancer, that counts. Chronic kidney disease, chronic lung disease, including COPD or chronic obstructive pulmonary disease, asthma, moderate to severe, interstitial lung disease, cystic fibrosis, pulmonary hypertension. If you have dementia or Alzheimer's disease, if you have type 1 or type 2 diabetes, Down syndrome, heart conditions such as heart failure, coronary artery disease, cardiomyopathy, hypertension, HIV infection, immunocompromised state or some sort of weakened immune system, liver disease, overweight and obesity, and overweight is defined as a BMI greater than 25, and obesity is defined as a BMI greater than 30. Pregnancy, you should get a booster if you're pregnant. Sickle cell disease or thalassemia. Smoker, organ or blood solid organ or blood stem cell transplant recipient. History of stroke or cardiovascular disease, substance abuse disorders such as alcohol, opiate, or cocaine use. Okay, that is the list of people that they say qualify under medical conditions who are 18 to 64. So the 18 to 49, it's just a may recommendation, and they would say underlying medical conditions, you probably need to discuss it with your doctor. 50 to 64, you should receive it if you have any of those underlying medical conditions. 65 or higher, you should receive it. If you are a healthcare personnel or a teacher, or you work in an institutionalized setting, or you're a jailmate, then you need to consider whether or not you want to receive one, and that is an option for you. Okay, so straight from the CDC, hot off the press. And hopefully that has answered some questions, but let me just remind you, this is Pfizer only. If you're a Moderna, then right now there is no recommendation for a booster. And that's okay, because just the way things have worked with Moderna, that right now is okay. And they're looking at that one very closely, and they'll make recommendations on that one later, and we will let you know. If you are looking to get a Pfizer vaccine, we are going to schedule starting on Monday. And you can call the clinic and schedule, because we are worried that there may be several people who want it. We want to make sure that we're actually scheduling instead of doing walk-ins. So call the clinic and schedule. Now, you don't have to come to us if you don't want to. You can go anywhere that has Pfizer. So we have it The health department has it, UMS has it, Baptist has it, I think Conway Regional, but don't quote me on that one. But if that is you, then and you want a booster, then I would recommend you call and schedule it. But first, look at your card, make sure it says Pfizer, and make sure it's been 6 months since your last vaccine. Okay, so if it is any date after March 24th, then wait until it's 6 months later. Okay, y'all have a great day, and let me know if you have questions. I'll do the best that I can to answer them, kind of in between everything. But if I don't get back to you, I'm paying attention, and I will try to answer those later. Okay, y'all have a great day.